Hi guys, this is Dr. Bhupesh from Dr. BKM OET Institutes. Today, after a long time, we are going to discuss writing module like just the complete letter. How should we attempt the complete letter? Obviously, we talk a lot about writing grammar and everything. But as I normally say, writing is very easy, especially with Dr. BKM Institutes. You guys must have seen the results as well, that writing is easy to get even 350 rather than 300. So I'm attempting this writing in front of you guys. This is pretty hard writing in way. The only hard thing about OET writing can be sometimes you do not understand the purpose and sometimes it can be lengthy. So this letter, I don't know whether purpose would be difficult or not, but this letter you can see is really lengthy. And obviously, when you are sitting in the exam and you are allowed to write only 200 words, how challenging it could be, I can understand. Even for me, it's a challenge to concise this writing in one shot, but I will try to do that in front of you and let's see how we go about this writing. So I hope the screen is visible. You can put over the chat box if the screen is visible. I'm just gonna write a couple of words over here. Hi, can you see this? Hi, can you put it in the chat box if you can see this? Hi. Okay, yeah, cool. Thank you very much for responding, guys. So I'm just gonna start the letter. See, the first thing, the major thing when it comes to OET, what we get marks for is the purpose of the letter. Purpose of the letter is always hidden in the last. Like this is the last page of the letter. Okay, I will tell you. This is the first page, starting from 5th of June. This is the last page of the letter, 26 June, 1 July, January, February, March, April, May, June, sorry, 26 May, then it is 1st June. And then comes the last page. Let's see what is the last page. Before you write anything, you need to know what this letter is about. So this letter, the main thing about this letter is that you are writing the letter to whom? You are writing the letter to Dr. Jeremy Barnett. So this is the main thing. Because I will do all the data selection according to this person. Who is he? He is an emergency registrar on duty at Marlborough Hospital. So basically, I am sending the patient to the emergency registrar. So obviously, I can understand there is something urgent with the patient. That means patient is in critical condition. So why I want to understand what is that critical condition. So I will read the plan. Plan is a paramedic transferred to emergency department. Oxygen 15 liters via non-rebreather. So maybe he is having some oxygen problem. GTN patch applied. Morphine, that means he is having some kind of pain. Ipratropium bromide is kind of nebulizer, so he is having some breathing problems, tachycardia, and fusamide. So we are giving some kind of drugs, and obviously patient is in critical condition. Now I want to know what is happening to the patient. So I will go to today's visit. Today visit means last visit. So last visit implies this visit. So last visit is this 1st of June. Passing by the medical center and sudden onset crushing chest pain. So that is what happened with the patient today. He was passing near to our medical center and then there was a sudden crushing chest pain on the background of URTI, upper respiratory tract infection. So he had got some he has got today. This is last date is always today visit. So basically the main problem is onset of chest pain. It can be URTI and worsening asthma since last not relieved by arginine. So patient was already having asthma and it did not improve. Worsening asthma means asthma is getting worsened. If asthma is getting worse, obviously it means that he is having asthma from a long time. Because worsening means it was bad earlier, now it is worsening. So that is how reading and writing in OET is nothing different. It's about reading it carefully, like the way I am doing for you, that patient is having sudden chest pain on the background of URTI and worsening asthma. That means asthma is getting worse, not relieved by arginine, very audible wheeze. So he's having breathing problem, he's having wheezing. Examination shows there is mild ST elevation in the anterior leads. So ECG means problem related to heart, lungs, moderate wheeze, bilateral crackles, oxygen is 86%. Heart, slightly S3 sound positive. So that means today patient is having anterior MI, but likely word is given. Likely means possibly. These are the main words. Likely means possibly AMI, and that question mark is given. So it is not 100% that he is having acute myocardial infarction triggered by the respiratory issues. So due to this asthma, due to this asthma or asthma, whatever you say, he is having acute myocardial infarction. Or it can be acute exacerbation of asthma secondary to URTI. So he's having upper respiratory tract infection. So maybe that would have caused acute exacerbation of asthma, and then it could have been AMI. Or it can, and question mark again given, or it can be acute pulmonary edema. So now don't get confused when it's your final exam. First, try to sort out your first paragraph. Make it simple. First paragraph is this. This is the main thing. So now what I can see, patient is having AMI or worsening asthma or mild APO. So first of all, learn to write the first paragraph. I'm just going to write the first paragraph. You will see how easy. Again, the more you will think, the more the writing will become difficult. So first paragraph is all about writing it nicely. So I'm writing in front of you and you will see how much time it takes. If I am alone, it will not take even 10 minutes. I'm writing this letter to refer Mr. X who has been. This is the tense you guys know. This is the tense we use when we say has been plus third form. That is what I told you, passive voice. Has been plus third form. So I am writing this letter to refer Mr. X who has been suspected with, because question mark is given, so I cannot use the word diagnosed, I cannot use the word assessed. So who has been suspected with, this word is very important. Whenever there are two diagnoses and question mark is given, that means patient is suspected with either this or that. So patient is suspected with either acute or whatever AMI was given. I'm just going to check out. It was given anterior AMI, either anterior AMI, acute myocardial infarction. If I know the full form, I will write it. Or spelling cannot be wrong. I don't care about spelling when I'm teaching you. I'm telling you the method. So please, in your exam, you can't do spelling wrong. So who has been plus third form means today. It's passive voice. Suspected means by us. Has been plus third form means passive voice. That means patient has been suspected by us. So has been suspected with either acute myocardial infarction, which is triggered by respiratory issues, or it can be acute exacerbation of asthma. Same, nothing changing. You don't have to change anything. Secondary to URTI. It there may be, now there is an additional word given, mild IPO. So you can't really omit that. So I will write he may be having mild APO too. He may be having mild APO as well. Therefore, he is being referred under your expertise. This letter obviously is very big. In exam, you do not get letter like this. To be honest, it has not. They have not come for a long time. But I'm writing to emergency registrar, so I will write. Therefore, he is being referred under your expertise on urgent basis. That is the main thing. Now the first paragraph is complete. It does not take any energy. What I did, I have used this word, who has been suspected with either. Then I use the word or. Rest everything. Sorry. Myocardial infarction triggered by. Rest everything. I have used this word, who has been suspected with either. This I have added. And then or word has been added by me. Or it can be. either this or it can be acute exacerbation. So I gave two possibilities. And then I said he may be having mild APO as well. Therefore, he is being referred under your expertise on urgent basis. So my first visit is all complete. And I'm going to ask you on the chat box, is everybody okay with this? You don't have to write symptoms. You don't have to write signs. Can you see this screen and everybody okay with it? Please, until now. Okay, let me check out. Yes, yes, yes. All right, Usha ma'am. Thank you, everyone. All right. So that's very simple. Basically, you just write about the main thing. So why am I referring the patient? This is the purpose. So I want to tell the emergency registrar that he can be having acute myocardial infarction, or it can be this kind of a acute exacerbation of asthma. That is why he is having this symptom. That's it. You don't have to write. Now, in the final exam, what you will do, you have done the first paragraph. Now we will read the complete letter. In the final exam, you can read the complete letter first as well. But obviously, in exam, you don't have the option of erasing. So don't write first paragraph. I wrote it just to tell you that you can make it that simple. Now we will read everything about the patient. Okay. John Elvin is the name of the patient. He is 48-year-old patient in general practice. So he has come to our clinic. 5th June. 5th June was the first time. 5th May, sorry, 5th May again, sorry. January, February, March, April, May, 5th month. So 5th May, he complained of occasional mild chest pain on exertion, mild asthma, but otherwise previously well. So now you start understanding about the first thing, you understand to whom you are writing the letter. So we got it, emergency registrar. Then you try to understand the purpose. We got it that it can be AMI, it can be APO, it can be asthma. So this possibility. So we have got the reason, we have got the person to whom we are writing the letter, that is doctor. Now it is about knowing about the patient, because we have to tell everything to the doctor about patient. So complaint of mild chest pain on 5th of May, then had mild asthma, but otherwise previously well, nil family history of cardiac disease, no family history of cardiac disease. One packed day smoker, drinks 10 standard drinks. So this data is very important for me. So I would like at least to tell this thing that he's a drinker, he's a person who drinks and he smokes. Significant stress, so that can be the reason. Medication, seretide 2 puffs, salbutamol 2 puffs, PRN. So he already takes this thing. Why does he take this thing? Because he is having mild asthma. You should understand what is happening with the patient. So patient is already having asthma on 5th of when he visited for the first time. Then when we did objective means signs on examination. On examination, there was no chest pain, so we will not write about it. ECG nothing, then don't write it. If you do not know, even then don't write it. I don't know what is NAD. Never take the risk in OET because letter is already lengthy. You don't have to write anything. So only smoking and drink is the only thing, and asthma is the second thing for which he takes salbutamol normally. That's it. Three things we have found, nothing else. Assessment, early stages of ISD, ischemic heart disease, early stages when he came for the first time on 5th May. And if you remember, today date is 1st June. So that means 25 days ago, 5th May, 1st June. 1st June is today's date. So 25 days ago, patient had mild chest pain, early stages of ISD, and stress-related chest pain, and alcohol dependence, but not interested in changing. So we did check serum lipids, refer for the exercise stress test, review in 1 week. So we told the patient, we planned that you should go for serum lipids. We want to check your cholesterol, lipid profile. We want to check your exercise stress test, and we want to review after 1 week. Let's see what happened 1 week. Now try to understand the story. After 1 week, patient still had very occasional chest pain on exertion. See, the main thing is that he was having pain only on exertion. So if you can understand, this is the same, and even this is the same. Occasional mild chest pain on exertion. So he's having still the occasional chest pain. Runny nose, pharyngitis with increased asthma symptoms. So he has some kind of infection as well. Attendance stress with mild chest pain at high exercise load. Small, very significant ischemic, small, very some very slight ischemic changes present in the exercise test. So nothing special. Mild bilateral wheeze was present. Cholesterol was little higher. So not a big deal. He was having some kind of problems. Then ischemic heart disease. So the patient was assessed with. So in the present test, in the present, I told you that we write has been plus third form. So in this we write he was assessed with ischemic heart disease or angina. Sorry, angina. Okay. So now you would be able to see. So this is the only line you have to write. He was assessed with IHD or angina, or viral upper respiratory tract infection was found. This slash means either angina or ischemic heart disease. Okay, so two visits are done in my mind, and letter is big. So if I have to write this thing, if I have to write this first page, I will write it in front of you. So the second page would be about social history and medical history and first visit. Okay. On 5th May 2000, let me check, 2011. Okay. On 1st May 2011, he was found with, so I will replace the name as well, Mr. Elvin. Okay. Let's make it more precise. He was found with, or you can also say Mr. Elvin. You can write it once, not a problem. This is not a big deal. You can also write he or you can write Elvin, but E capital. So Mr. Elvin was Mr. Elvin active, complained of. This is an active voice which is represented by second form. So I told you was plus third form is passive. So now this is active because patient himself is complaining. This is the main thing, second form and was plus third form. This is the only tense of OET. So Mr. Elvin complained of mild central chest pain on exertion. And he reported, this is the best word you can write when you want to mix social history or medical history or visit. So we are mixing visit, and he reported that he is a smoker and drinks how many things drinks 10 standard drinks 5 times a week and drinks as well. Don't go in over detail when you know you don't have sufficient word count. Letter is already lengthy. Don't go into detail. So Mr. Elvin complained of mild chest pain and he reported, this is the best word you can write. He reported that he is a smoker and drinks as well. Okay. Now on examination, there was nothing new. So now I don't want to waste too many words. He was a known case of asthma for which he was taking salbutamol buffers. That's it. Don't get into detail. Salbutamol puffs. And he was taking salbutamol puffs. Means as soon as you get into the detail, you are in trouble. So the problem is anxiety. When you get letter like this, it's anxiety. Keep your grammar same like we do in the simple letters. Just simple. He reported that he was having this. He was a mild case of asthma. Same connector for which he was taking salbutamol. 2 puffs a day if you want to write. Otherwise, you just say salbutamol puffs. That's it. So what was that? At that time, he was assessed with early stages of IHD and stress-related chest pain. So this is very nice, as I always say. At that time means on that day. You can also write on that day. Yeah, or you can say during that visit. You can use anything which is common with English. You can also say during that visit. So why during that visit? Because today is 1st June. So I am telling the doctor during that visit, which was on 5th May. So during that visit, he was assessed with. When assessed word is given, so I will write assessed. Early stages of IHD and stress-related chest pain. Same, nothing changes. That's it. So you just go with the flow, don't worry. Further, he was advised to undergo few tests and come back after 1 week. So this is the story that is going. That is the story that is ongoing. So let's see how we go further. And you will see still the word count is pretty high. Means if I want to leave something, I can, or I can mix up first two visit. So I can mix the first two visit. How come? We can also say during first two visits, Mr. Elvin complained of mild chest pain, reported he was known cause of asthma during those visits, because there are two visits, so that becomes plural during those visits, and there is S as well. This is marks of grammar. He was assessed with early stages of IHD, and then we will not write about test. So now I have mixed up two visits, and I will tell that he was having ischemic heart disease or angina that we have already mentioned. So viral upper respiratory tract infection. During those visits, he was assessed with this and also upper viral URTI. Simple means what I have done is, rather than thinking too much, I have mixed up two visits. Now my two visits are over. This is what you need to learn, and that is what will save the data. So I missed during first two visits. Mr. Elvin complained of days pain on exertion, reported that he is a smoker, drinks as well. Known case of asthma for which he is taking puffs. During those visits, he was assessed with early stages of IHD and stress-related chest pain, and or viral URTI, or we can say and viral URTI. We can release this, and this comma is maybe causing the problem. So I will say he was assessed with early stages of IHD, stress-related chest pain, and viral URTI. That's it. Now I need the medications. So let's see. Now we are almost there. If you can understand, now I don't find myself in too much of problem, because I am almost there on the last second page. Commence on Lipter, nitrates, aspirin, arginine, educate arginine in leaves, for which few medications were advised. So why to write all these medication? We will enclose the medication chart, because we can't write everything because letter is too big. So we will say for which, but for which we have already used. So we will say and for that. When you have already used for which, so you can replace this word with and for that. Few medications were commenced or advised or prescribed, your wish. So that is what you need as a person, or as a confident person, to mix those visits. Because this visit, the last visit, is very important. We can't skip this data. That is why we have to skip the data from above. Now in this visit, chest pain for the last week, frequent mild wheeze, often forgets to take puffers, mild bilateral wheeze still present, mild asthma secondary to compliance medication. So he is having decreased compliant medication. That is the only thing. Alcohol dependence, which is now affecting the medication compliance. So basically on third visit, the main thing is that he is having mild asthma due to not complying with the medications and due to alcohol dependence. So emphasized importance of anti-asthma medications, recommended patient to reminder asthma, encouragement salbutamol. So there is nothing specific about this visit. So I will mention it over here. On 26 May 2011, he visited with mild bilateral wheeze, pleasant, nothing special, mild asthma. So on 26 May, there was no progress. Now I am adding my common sense. There was no progress as he was having mild asthma due to non-compliance with medication. So that was the main thing. So I again used my common sense and I mixed up everything. Due to non-compliance with the medications, there was no progress. There, so therefore, he was educated regarding the importance of complying with the medications. It's simple, guys, again. And I am writing in front of you, the whole letter is about to complete. Now, my last visit. So it just needs a lot of daring that you don't have to worry. What is important, you write thing. So we told him that see, you have to drop things, you have to. So we gave overall counseling or education regarding the significance of taking medications. That was given emphasized importance of preventive anti-asthma medication. This is the main thing. This is the main thing that gives you marks today. The patient has okay. Today the patient now grammar. Earlier we were saying patient was admitted, passive voice, patient was diagnosed, he was educated. Now was becomes has been. Today the patient has been admitted due to sudden sudden onset of crushing chest pain. This due to word is very important to learn. Today the patient has been admitted or he has been admitted. Now the main thing is has been plus 30. Wonderful. Means that is what examiner wants to know, that you know grammar or not. In the past, you were saying he was assessed, he was diagnosed, he was plus third form. Then you were saying he was educated. Now you are saying has been. This is the change of grammar which gives you marks. Now you have told that patient is having sudden onset crushing chest pain on the background of URTI and worsening asthma. So we will write this on the background. You don't have to change anything on the background of URTI and worsening asthma. That's it. So I've mentioned both of them. So the main things have come. So we have told that patient has been admitted due to this thing. So ECG shows, now you can write in the present. ECG has shown, again, stick to present perfect. ECG has shown mild estivation, mild ST elevation. Don't write everything. ECG has shown or revealed mild ST elevation. And lungs, moderate V's bilateral crackers. And in lungs, there is, means write simple English if you want to get 400. And in lungs, there is moderate V's and mild bilateral crackers. So you have mentioned everything that is having this problem. Heart, slight S3 sound positive. Positive. So try to change your grammar all the time. Positive or a slight S3 sound. Okay. Positive S3 sound is present as well. So now on the basis of these signs and symptoms, on the basis of these, so otherwise I can write therefore, but I have already used therefore 2 times. So on the basis of these signs and symptoms, he seems to be a case of, why to write everything again, of anterior AMI. Don't write everything again. AMI or acute exacerbation of asthma. for which your and always end this, for which your expertise is highly required. So that is your letter. Or your expertise would be highly appreciated. You can write anything. Your expertise would be highly appreciated. That's it. Letter is over. Word count. Let's see what is the word count. If I can see the word count. So in one line, I have written almost 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Almost 10. In this line, there are only 6, but still I am taking 10. 1, 2. In this line also, there are 5. So I think 7 should be on average. And this also not 10. So yeah, okay, let's take 8. 1, 2, 3, 4, 5, 6. This is how you will do the word count even in the exam. So around 50 words. 1, 2, 3, 4, 5, 6, 7, 8. Around 64 words. 8 into 8, 64. 1, 2, 3, 4. Around 32. So 50 plus around 60. 110. Around 40. 32, let's say 40. 110 plus 40, around 150. And then 1, 2, 3, 4, 5, 6, 7, 8, 9. So 9, 8 is 70. So it's around 220 words. Maybe it's less than that because some lines do not have even 8 words. If you consider this line, 4 plus 4, 8. 1, 2, 3, 4, 5, 6, average 8. 1, 2, 3, 4, 5, 6. So 2 words are less. So it should be around 200 words. So basically you can count those words. The letter is in front of you. I will upload on the YouTube. This is how you write the letter. Now, when you are done with the letter, it will not take much time. Trust me. You have got 45 minutes and I'm teaching you. Still, I have taken less than 40 minutes. Now, time to revise. Now, forget the question paper. Try to see that you have written the right story. So let's see what we have written. I'm writing this letter to refer Mr. Elvin, who has been suspected with either acute AMI triggered by the respiratory issues, or it can be acute exacerbation of asthma. So emergency doctor wants to know that patient can be having asthma, exacerbation of asthma, or it can be AMI. So he will be very quick. He is an emergency registrar. There may be mild APO as well. Therefore, so doctor will say, okay, I got it. Then doctor would like to know about what happened. So during the first 2 visits, he complained of mild chest pain. He reported that he's a smoker and drinks. Now doctor knows he's a smoker and drinks. He was a known case of asthma. So doctor understand that already he has a history of asthma, for which he was taking this. During those visits, he was assessed with IHD. So already we were diagnosing the patient. We were assessing the patient with IHD, something related to that, and chest pain, and there was viral upper respiratory tract infections. Doctor will understand that he had viral upper tract infection, he had IHD, he had stress related chest pain. Then on 26th May, there was no progress. So in this, only one thing I have visited. On first 2 visits, means I should write on first 2 visits because I want to write the visits which were on, it's over. I don't have to write it, but still, which were on 5th May. And what was the other date? Sorry, just a second. And 12th May, which were on 5th May and 12th May, respectively. This I'm doing extra just to keep myself at best. So I'm telling the doctor that 2 visits were around 25 days ago, and 12 means around almost 18 days ago. Today is 1st June. So that's what I'm extra trying. So this is very nice. Which were on 5th May or 12th May respectively. Mr. Elvin complained of this thing and this thing. And then on 26th May, there was no progress. He was having mild asthma due to non-compliance with the medications because we prescribed some medications, but there was no compliance with the medication. That is how the story is cooked, that he was having this problem for that few medications, but he did not comply with the medications. So he was educated regarding complying with the medications. Today, the patient has been admitted due to sudden onset of crushing chest pain. So today the problem is that he got this sudden onset pain. ECG has shown this, lungs is showing V's, and there is bilateral crackles. Positive asphyxic sound is present as well. So on the basis of these signs and symptoms, I'm telling the doctor, so on the basis of these signs and symptoms, He seems to be a case of anterior AMI or acute exacerbation of asthma for which your expertise is highly required. That's it. Letter is all over. Should you require further information? So what you need is courage. That last visit, you can't drop the data too much. So you have to drop the data in the first 2, 3 visits. Last visit is the main visit. That is why you are referring the patient, because there was a sudden onset of crushing chest pain and he fell. So should you require further information, feel free to contact us. Yours sincerely. Yours sincerely is written when the name of the doctor is given. So let's see whether the name is given or not of doctor. So name of the doctor, I think it was given Dr. something. Yeah, Dr. Jeremy Barnett. So the name is given. So I will say Dr. So I will say yours sincerely. Okay. So yours sincerely, charge nurse, or you can say registered nurse. Just doesn't make a difference. If your name is given, that's good as well. And now, if you want to learn the complete pattern, how to write in the start. So you start with Dr. What was the name? Dr. Jeremy Barnett. No commas, nothing. What is he? Emergency registrar. Spelling again should be correct. I'm just doing for you guys again. Marlborough Hospital, Lakes Road, Marlborough. Okay. Was the spelling? Lake Road. That's it. You are all done with your letter. This is the complete format. You have written this. Today date is 1st June. This is very important because that is how he would be able. Why this date is important? Because now he can relate that 1st June and 5th May. So that means almost one patient visited almost 25 days ago. Then you write, dear sir, dear Dr. Barnett, and then you say the patient name regarding. This is the pattern. For all the new people out here, Mr. John Elvin, comma, aged 48. Complete letter done. So it does not take time. It just takes courage. Grammar has to be controlled. Main grammar thing again, which I have always told you, that when you will sit in your exam, in the final exam, the first thing you will do on the question paper or rough sheet is this. Everybody who has seen our videos, so you will say past visit, you will say today visit. You will say past visit active, second form, past visit passive was plus third form. So this everybody will write. Today visit active has plus third form, and today visit passive has been plus third form. This everybody will write. Everybody. This is active. This is passive. This is to attempt. Everybody will do. Now I will again show you where have I applied this. Again. Who has been suspected? Who has been suspected means today. Has been plus third form, passive voice. Suspected by us. Then Mr. Elvin complained of. That means active past. Second form. He himself complained. We did not. Then he reported. Again active. Then we said he was assessed with by us. So was plus third form by us. Few medications were prescribed by us. So that is how you control the grammar, by checking it. In the last, do check it like the way I have done it. Overall, now almost 40 to 45 minutes are over. So this is Dr. Bhupesh from Dr. BKM Institutes, and you can well understand how much patience it takes of mine as well to write the complete letter. And being a doctor, not writing it with pencil, rather to write with the computer and typing, how hard it is. But it's nothing about hard or easy. It's about how desperate you are to achieve your goal. It's just about your desperation, that how willing you are to achieve your target. So this is Dr. Bhupesh from Dr. BKM Institutes executing this tough visit letter to control the words. But again, listen to it 2-3 times so that when you sit in the exam, you have the courage to do it. Mix up first 2 or 3 visits, even 4 or 5 visits. If something is same, like he was having the same mild chest pain on exertion, so why should I write again and again and make my letter lengthy? So I mixed up the first 2 visits, then I made up the third visit. Even third visit could have been mixed up. Today is something that cannot be mixed. Social history could have been separated, but then it was given in the first visit. So I said he reported. So that 2 words he reported, that saved everything for me. Sometimes 2 words are the keys, like he reported. This is the key. So when you focus on this small key, it makes your life easy. I hope you all have learned. Please try to follow, and I assure you, we are not targeting 300. We are targeting 350 or 400. And you can ask all the previous students of Dr. BKM OIT Institutes how good we are in every module, including writing itself. So please follow this pattern. Thank you very much. Thank you.